Hi, can you please introduce yourself and your field and the training that is required to practice it?
Yes, my name's Brian Aronson. I'm the Director of Vascular and Interventional Radiology at Northeastern Ohio Medical College and Director of the Special Procedures Laboratory at Mercy Medical Center in Canton, Ohio.
So,
The requirements for my field is a specialization in radiology and in vascular and interventional radiology, which is all based on my medical diploma. I'm a graduate of the University of California, Berkeley, and Northwestern University Medical School for my medical diploma and all my specialty certificates.
okay, what's role does chemistry play in your field?
Chemistry is really integral to all of radiology. It plays a role in identifying appropriate contrast agents so that specific organs can be appropriately highlighted using our imaging techniques. In addition, chemistry plays a very important role in the delivery of radioactivity to target tissues, whether it be because they are malignant or just hyperfunctioning.
Okay, how about inorganic chemistry? Specifically, how does that play a role?
Inorganic chemistry specifically plays a role in the development of the contrast agents which absorb external generated X-rays in order to create increased density on radiographic images, as well as providing the materials for delivery of radioactive particles for both imaging and therapy.
And has this role changed at all in the last 10 years?
Most of what we do now has been developed up to about 20 years ago, developed over about 100 years before that. Nuclear medicine since the 1920s or 1930s, certainly nuclear magnetic resonance was not introduced into medical imaging until about 1980. However, nuclear magnetic resonance has been active in scientific research since the 1920s.
Okay. So what role could a chemist potentially play in radiology?
Chemists are really critical professionals within radiology, both in radiation oncology, which is a separate field of radiology, and in radiation physics. Radiochemists act as radiopharmacists in preparing radiation doses for both diagnostic and therapeutic needs.
Okay. Now, specifically for the work that you do, how do you use inorganic chemistry in your specific practice?
I am an invasive imager and also a therapeutic physician. I use chemistry by delivering X-ray contrast agents directly into blood vessels, bile ducts, and the enteric tract in order to get diagnostic pictures as well as guide therapy. In addition, I deliver radioactive particles directly to tumors to assist in the treatment of cancer.
Okay, that's all very interesting. If a young chemistry student were to be interested in this, how would you advise them?
Of the many roles available within radiology, the dominant role still is to this day the practice of medicine. So certainly a young chemistry student wanting to practice radiology would best be served as a physician and so therefore go into medical school. There are other opportunities, however, including the radiochemist and radiopharmacist, which has a separate specialization and certificate by the American College of Radiology to maintain and assure radiation safety and appropriate radiation doses, as well as university positions where the development of contrast agents and other therapeutic delivery agents would be developed.
Okay, is there anything that a university student, somebody like myself or my colleagues, could do to get more exposure to what a radiologist does on a daily basis?
Most academic radiologists would welcome you as a shadow for the day or even longer. Certainly for those who are interested in medical school, rotating or coming by to talk to us would be welcomed by virtually everyone in practice.
Okay.
Well, thank you very much for this opportunity to talk about my field, and I hope that this brings interest to the young chemistry students of your class.
Thank you. It's a pleasure to have you.